All right, team, welcome to Aging in Motion. I'm going to use this as an opportunity to talk about my philosophy as it relates to physical therapy, exercise, human movement, and our ability to participate in life. And I really think that's what physical therapy should be about is enhancing the ability to participate in what's important to you and participate in life. Um, so in kind of journaling and doing blogs and writing over the years, thinking on this. I figured short form content was not meant for me. I need to be able to talk about the gray area and the vague stuff and the nuance of some of these conversations. So I've got some notes over here. We're going to go through some stuff today, and mostly we're going to talk about big picture stuff as it pertains to physical therapy. So the first thing that I really want to talk about is what makes good physical therapy. And being somebody that's worked in a couple different settings for a couple different size companies, some of the biggest rehab companies in the country, some local regional companies, and then starting my own physical therapy practice, I can see the different stages of quality of physical therapy. And um, I want to paint the picture of what success looks like through my eyes as a clinician. And we'll talk about the first visit when somebody first walks into a physical therapy clinic. In our setting, since we're direct access, um, direct pay physical therapists, often folks want to use their benefits first. So they try these big box PT clinics, these physiotherapy clinics, and some of them work. Sometimes there's some good physical therapists that still have the time to commit to their patients, and oftentimes they're overbooked and overworked and don't have the ability to truly treat the patient from start to finish as they know they need to. And it's not a fault to the clinician; it's a fault to the model, and really not to be anti-establishment, but the insurance companies have structured a reimbursement system that just does not help us as clinicians and practitioners from the physical therapy level all the way up to, really the surgical level. Everything is rushed and everything is quantified, and there's a difficulty to provide to feel empowered to provide the highest level of care until we get to a model that's our size, that is direct to consumer, takes out the middleman, takes out the nuance of red tape and insurance authorizations and um, playing this game of back and forth. It's just the patient and the clinician, and that is the purest model of healthcare and the most effective model of healthcare. So at our level in physical therapy, at any setting I've worked in, what somebody wants from their first visit are a few things. First, they want to be able to understand what's going on in their body, especially if they've been to one of these other PT clinics. They've been put through some of the same exercises for 3 weeks or 3 months or whatever it may be. If they've tried the traditional physical therapy and it's failed, they can be frustrated with their body and they start to think there's something more insidious going on here. They start to think that their body is damaged or incapable of healing. And sometimes they're just looking for an explanation on an anatomical level of what might be going on and reassurance that the human body isn't perfect and it does wear out as we age, but that isn't a bad thing. Joint degeneration, arthritis, uh, labral tendon fraying or degeneration is just like having gray hair. It's going to show up. And one of the doctors that I worked with for a long time at Vanderbilt, he said arthritis is like having gray hair, and your decision as a patient, somebody with arthritis, your decision to make is, do I have gray hair and sit on the couch and continue to have gray hair, or do I have gray hair and get up and move and continue to have gray hair? Either way, we're going to have gray hair. We're going to have arthritis. But if we get up and move and do something about it, we can preserve function. We can grow our muscles so they support the joint a little bit better, so the pain is not as bad, so that we can be more functional, so that we can participate in our golf group. We can lift our grandkids. We can go walk a 5K if somebody invites us to 2, 3 weeks out. Whatever it is, we have the choice to embrace that gray hair, that arthritis, that aging that's going to happen to all of us, but we can take control of it. And we do that through movement, through proper medicine, through proper nutrition, through weight control, all of these things that we try to incorporate at Elevate 615 and our form of physical therapy. So that's the first thing. Folks want reassurance. They want to understand what's going on in their body from an anatomical perspective. But they also, what they're looking for is a plan. They they want to know that the person across from them, the clinician, is confident in their ability to recover. And I think this is what makes a really good clinician. When I was in my first year of being a physical therapist, my clinical mentor said something to me that has just stuck with me, and it's really our job is to not mess the person up, because more often than not, the body does a really good job of getting the person feeling better on its own. So if we can be there to accelerate things, or through that recovery window, make things a little more tolerable without overdoing it, or without um, convincing folks that they're fragile, if we can mitigate pain while really educating folks and empowering them and helping them feel confident in their bodies, and their body's ability to move and do the activities that they were doing before pain free, without risk of injury, then that's really what a lot of our patients are craving, is that reassurance that I am confident that you have the ability to recover, because your body is resilient, because I'm not going to push you too much, or not enough, to where your body doesn't recover and enhance its capacity through this remodeling and recovery and inflammatory phase that's good to restore those tissues. So those two things is really are two of the primary things folks look for in their first visit, is uh, an understanding what's going on, kind of a diagnosis. They want to see confidence in their clinician, and in their ability and their capacity to recover as a person. And then they want to understand a plan. So as a physical therapist, laying out in very clear language, this is my plan to get you better. And this is the first 3 visits, what I plan to do and what I plan to figure out in your body. I tell all of our new clinicians that we hire, uh, especially if they don't have a lot of clinical experience, no PT in the world should have or feel as if they have the patient figured out in 1 hour evaluation. The human body is far too multifactorial and complex. Human nature is far too dynamic to think we have somebody figured out in one session. We might have the diagnosis nailed down. We might have symptomology and clinical behaviors of this person's condition figured out. We don't understand their rest and recovery. We don't understand their exercise volume. We don't understand their beliefs and commitment to their health and their exercise program and their style of exercise. All the nuances of the relationship with their body and with movement are things that take sessions to figure out, if not months to figure out. So we really need to look at the person through a large scope lens, and it takes 3, 4, 5 sessions to really understand the whole body and the whole condition of this individual. Even if it's an ankle sprain, we're probably going to find some weakness in the core and in the hip. That stuff we should look at day one, but really taking time to figure out truly that connection, and their understanding of that connection, and their ability to coordinate that connection, whether it's core to ankle or whatever it may be. It takes time to figure that out. And then moving past that, our next few sessions It's an experiment. We're working with you as the patient to figure out how you respond to different stimuli. If it really, as a clinician, we feel empowered and even more confident if we can have you do a squat and it makes your condition better or worse, then we add that to our algorithm. And then we expand that and add it to our tool belt. And we find out that these 5 things make you feel better. These 5 things seem to provoke your pain. So our job is to figure out how to use those things to identify the tissues or the condition that might be impaired in your body, and also folding them in. So if it's 5 things that seem to provoke your pain, I'm going to put those on the back burner, but I'm not going to totally throw them away because I want you as a human to be able to accomplish those 5 movements someday without pain and with the ability to do everything you want to do. And then where a lot of traditional physical therapy goes wrong is we get you back to, really, in some of these busy clinics, we aim for 80% recovery. Get you back to, you're feeling pretty good. You're, a 9 out of 10, or you only have pain once a week when you do that one thing. That's pretty good. Take these 15 exercises and do them 3 times a week, and hopefully that does the trick. It doesn't do the trick. What we need to do as physical therapists and as patients is commit to a program that fits with your lifestyle, one that folds into your natural routine so it's not overwhelming, but it continues to challenge the tissues of your body, the muscles and tendons and joints to adapt to make them more resilient, but also challenge you um, to achieve not just baseline, not just 80 or 100% recovery, but we want to go beyond that. Whatever your goal was before that, let's talk about it. If you really didn't have a goal, then let's come up with one and figure out what 120% looks like. There's no reason that, your condition before you got hurt to come to PT was 100%. So let's establish an entirely new baseline, and that takes time, that takes one-on-one attention, and that takes performance therapy. So all of that together, we need a diagnosis and education of what's going on. We need reassurance and confidence in the clinician and in the patient's ability to recover. And we need a plan that we work on collaboratively that really paints a picture of the steps that we need to take and how long each step is going to take to get the person better and to get them to really new heights, to get them doing their first 5K or their first uh, high rocks or their first lift, or back to being a grandparent that can carry their kid, over their shoulders at Disney World without having neck pain for 5 days. Whatever it may be, let's not just talk about baseline. Let's talk about going all the way to even better, and that's performance therapy. And that picture as a whole is really what physical therapy looks like. In the current landscape of insurance reimbursement models, it's just difficult to accomplish that, and truly provide that level of value to our patients. So that's really been part of the mission for Elevate 615. We're really trying to elevate the health and wellness of the individuals in this area, and also elevate the quality of care that we can provide as physical therapists. And in a way, it might seem a little too big picture, but um, change the landscape of healthcare, because I do think it's moving more to this boutique customer to provider pay structure. You see these concierge physician clinics popping up left and right. You see these med spas popping up on every corner. It's because there's a market for it, and the consumers and patients are craving it. And I think if more and more clinicians are able to practice like we practice here, I do think the landscape is going to be totally different in a decade, in 15 years, and it's going to be much better for the average patient.